My name's Stuart Kinner. I'm the head of the Justice Health Group at the Murdoch Children's Research Institute and the head of the Justice Health Unit at the University of Melbourne in Australia. And I'm going to be talking about the key findings from our cross-cutting chapter on health in the UN Global Study on Children Deprived of Liberty. So this is a piece of work that involved a lot of people from the University of Melbourne, Murdoch Children's Research Institute, University of Sheffield, University of Exeter. So it's a multinational effort. And essentially it's a global scoping review of what we know about the health of children deprived of liberty in various settings. So this work was funded by the Murdoch Children's Research Institute. And I just want to start off by very briefly considering why we should think about the health of young people in these settings. And the key reason really is that the social and structural drivers of deprivation of liberty overlap a lot with the drivers of ill health. So for example, poverty, discrimination, mental illness, substance use are all factors associated with deprivation of liberty, particularly in the administration of justice, and those are also important drivers of ill health. So for that reason, it makes sense that we would expect to see a concentration of ill health among young people deprived of liberty in various settings. And so therefore, when we think about the health of young people in these settings, we're really thinking about health equity. We're really thinking about how what we do for young people who find themselves in those settings contributes to addressing health inequalities at the global level. So there are reasons to suspect that deprivation of liberty for young people might adversely impact on their health, and that's not surprising. We know, for example, that deprivation of liberty is an inherently distressing and traumatic experience usually, and is therefore likely to have some significant adverse impacts on mental health. We know that often the circumstances in which young people find themselves deprived of liberty can be harmful to their health. For example, young people who might be put in congregate settings where there's communicable diseases, tuberculosis for example, settings where there's inadequate nutrition, poor environmental circumstances can contribute to or compound poor health for young people. And we also know that deprivation of liberty can have long-term adverse impacts on health. Again, one good example with respect to administration of justice is that young people who've been detained may be subsequently stigmatised, may find it hard to get employment, to reintegrate into society, and that in itself can have some impacts on their health in the longer term as well. But it's actually more complex than that as well, because there are also some reasons to think that deprivation of liberty can actually improve some health outcomes in some circumstances. So for example, when young people are deprived of liberty in therapeutic settings, for example, in psychiatric facilities, that's notionally to improve their mental health. Whether or not it does is of course a separate question, but certainly that's the intent. For example, young people in institutional care may be put there based on the view that that is the lesser of two evils, that for example, young people who may be homeless or experiencing significant abuse or neglect may experience some benefits associated with being removed from those circumstances. And even in justice-related detention, which of course is inherently punitive, there can be some positive health benefits. For example, particularly in some higher income countries, routine screening for communicable diseases is common, catch-up vaccinations, initiation of treatment for untreated health conditions. So there are some reasons to suspect that at least for the period of time where young people are deprived of liberty, there may be some exceptional circumstances in which in some ways their health can improve. So what do we know about the health of young people in justice-related detention? This is probably the area where we have the most literature, but still there are some really important gaps in the evidence. We do know that young people in justice-related detention typically come from backgrounds of extreme, often intergenerational disadvantage. We know that experiences of trauma are normative among young people in these settings. And we know that multi-morbid health conditions, as in multiple health conditions co-occurring, are common in these young people. So that includes mental illness and risky substance use, substance dependence, and the co-occurrence of those conditions, often called dual diagnosis, is extremely common among young people in these settings. And that's partly due to the criminalisation of substance use and to the sorts of behaviours that young people experiencing mental health problems and substance use problems may engage in. We know that self-harm and suicidal behaviour are more common among young people in these settings. We know that the prevalence of sexually transmitted infections and bloodborne viruses such as HIV, hepatitis C, tuberculosis are more prevalent among young people in these settings. We know that oral disease and other chronic conditions are more prevalent among young people in justice-related detention than in the surrounding communities. And we know that there's a very high prevalence of neurodevelopmental disorders, traumatic brain injury, fetal alcohol spectrum disorder, and so on. And so there's a really high concentration of complex health conditions among young people in this setting that necessitate a coordinated multidisciplinary response. So young people in these settings also engage in some poor health risk behaviours, so that there's a need for some health promotion and health literacy education. And we also know that young people in justice-related detention often have failed to be able to access appropriate healthcare in the community before they enter that setting. And for that reason, sometimes there can be some improvements in health for young people coming into that setting when health conditions are identified and treatments initiated. As for the impact of deprivation of liberty in this setting on health, the evidence is quite mixed. And now that's not to say that deprivation of liberty in the administration of justice doesn't cause health harm. It almost certainly does, but the evidence for that is quite mixed. And as I've said, there are certainly some isolated cases where there can be improvements in health in those settings. Whether or not those improvements are sustained after young people return to the community is a separate question. So in our review, we covered the health of young people deprived of liberty in all settings. And although those settings are quite unique and the young people in those settings come from different backgrounds and circumstances, it's nevertheless the case that in all of these settings we see a concentration of ill health. We see a concentration of multimorbidity, multiple co-occurring health conditions that necessitate a coordinated response. And it's therefore true across all of those settings that responding to the health needs of young people who are deprived of liberty is important to addressing health inequalities. So in the chapter, we do talk in detail about some of the differences. We talk about the lack of evidence in many settings, particularly in low and middle income countries, to help us understand what the health needs of these young people are. Overall, what we found from our review is that most of the evidence out there is quite poor quality. There are some very high quality studies, but most of the research that's published about the health of young people deprived of liberty is quite poor quality, and we really need more high quality studies to better understand their health needs. There's a striking lack of research published in some settings. A notable one is immigration detention settings, where although the evidence that we do have strongly suggests very significant health problems, particularly mental health problems, there's not nearly enough published about that so that we can fully understand what the health needs are and develop evidence-informed responses. As I've said, the research is concentrated in a handful of typically high-income, often Western countries, and we really need more research at the global level to understand the health needs of these young people. One of the interesting things is that even though we have an obligation to uphold the rights of young people deprived of liberty to the highest attainable standard of healthcare, we know almost nothing about health services for young people deprived of liberty. Although we know that they have significant health needs, we really know almost nothing about what member states are doing to address those health needs when young people are deprived of liberty. And that's another important gap in the evidence. There's also a disproportionate focus in the literature on certain health conditions, particularly HIV, mental illness, which are of course important health issues, but as I said before, multimorbidity is normative. Most young people in these settings have multiple co-occurring health conditions, and so there's a need for a more rounded understanding of their health needs. There's very, very little evidence about the health outcomes for young people after their release from places where they're deprived of liberty. So that's important because even in those rare circumstances where young people receive good quality healthcare when they're deprived of liberty, there's some evidence suggesting that those health benefits quickly dissipate once people return to the community and to the circumstances from which they've come, such that the net effect of being deprived of liberty is likely adverse. It likely makes things worse in the longer term. It's very, very hard in the literature to figure out whether a deprivation of liberty harms health. And the reason for that is that many young people come into these settings already distinguished by complex, underserved health problems. So even though we typically see that young people who've come out of these settings have very poor health, Many of them had poor health before they were in that setting in the first place, so we can't infer from poor health outcomes after release from places where young people have been deprived of liberty that deprivation of liberty caused those poor health problems. There are ways to explore that through high quality, carefully constructed research, but as I've said, to date there's been relatively little research of that quality in the literature, and that's another important gap. So just to summarise, we know from the evidence, thin as it is and skewed towards particular health conditions and particular countries and settings, that children deprived of liberty are distinguished by histories of trauma, by disadvantage and by complex co-occurring health problems. And therefore our policies regarding deprivation of liberty and regarding the health services we provide for young people who are deprived of liberty are relevant to health inequalities at the global level. We know that children deprived of liberty in one setting are also at increased risk of being deprived of liberty in another setting. So for example, young people who've experienced psychiatric hospitalisation are at increased risk of being detained in the administration of justice. Young people who've been detained in that setting are at increased risk of subsequent adult incarceration. Young people who've been detained in the context of armed conflict may be at increased risk of immigration detention if they move to another country. So it's the case that deprivation of liberty clusters around young people with significant health problems in vulnerable and challenging circumstances. Nevertheless, it's the case that deprivation of liberty can unfortunately provide some very regrettable public health opportunities. And so therefore, the health services that we provide in places of detention for young people matter. It matters that we provide them with the highest attainable standard of health, even if they are deprived of liberty. So what that means is that while we continue to work towards minimising deprivation of liberty and using that only as a measure of absolute last resort, that doesn't mean that we should compromise on the quality of healthcare that we provide for young people who do find themselves in those settings. It's not an either or. We also know from the limited evidence that deprivation of liberty has adverse impacts on health, so it's not good for the health of young people to deprive them of liberty. There's a lot we don't know about that yet, but there is quite strong evidence, for example, with respect to immigration detention, with respect to detention and administration of justice, that deprivation of liberty harms mental health. It's an inherently distressing and traumatic experience, and again, it's something that should be a measure of last resort only. But, as I've said before, it's the case that the impact of deprivation of liberty on health depends greatly on what happens for young people in those settings, and therefore providing quality care is important. And so lastly, I guess the point of all of this is to say that while we continue to work towards minimising deprivation of liberty for young people for multiple reasons, and including that it has some adverse consequences for health, we must not just work to reduce deprivation of liberty, because for some young people, that's unfortunately their best opportunity to have unmet health conditions diagnosed and treated. So what we need to do in parallel with efforts to reduce deprivation of liberty is invest in appropriate, youth-friendly, multidisciplinary responses to their health needs. And as I said before, that's important to addressing health inequalities at the global level.